My role as a perinatal nurse navigator is really focused on the high-risk pregnancies and deliveries that are upcoming here at Reston. High risk meaning if you have a maternal and or fetal condition that your doctor has deemed you as high risk, I would be an added layer of support to walk you through your pregnancy journey, help with any specialist appointments that you need to make, help coordinate tours, different classes of the facility and the NICU if needed, and just be that person that connects the dots between the different disciplines within the hospital to make sure that you're as prepared for your delivery as possible and you have the safest, best experience here.
My name is Dr. Wes Hodgson. I'm the director of the OB Hospitalist program at Reston Hospital. I came from a private practice a little bit south of here for about 8 years, which is a typical background for a hospitalist. And before that, I practiced in the U.S. Navy. An OB hospitalist is a board-certified obstetrician who is on site in a hospital, literally on labor and delivery, 24 hours a day. Our role is to partner with your doctor to back them up, assist them, be there if they're not available, whatever they need to ensure safe delivery, safe care, 24 hours a day.
I have been a neonatologist since 2011 as part of the faculty at Children's National Hospital. Children's National Hospital and Reston Hospital Center have now collaborated to be able to provide neonatal services to our most vulnerable patients. So a level 3 NICU is one that will care for premature infants and infants who require some sort of support after birth, meaning they require respiratory support, perhaps support for a suspected infection, and those that are born preterm, we will be able to resuscitate and care for down to 23 weeks gestation. So even our extremely low birth weight and very vulnerable populations, we would be able to keep here at Reston, again, closer to home.
We actually have had 2 experiences here. Our first son, Creed, was also born here, complete regular pregnancy. And then when Michael was born, we actually came to the hospital because I didn't feel him moving that much. Came into the maternity section and they monitored me for, I would say it was about 12 hours. And his heart rate kept dropping, his oxygen level kept dropping. So finally they decided that he needed to be born, which was the next afternoon. So he was born emergency C-section. He was 27 weeks and 1 day.
Ran over to the elevators and then they wheeled him by and he was, really small, maybe like the length of your hand, and was breathing really heavily. That's my first time seeing a baby that small, and it was just enough time to stare at him to kind of take it in while the elevator doors were opening. He went inside, doors closed, and then he was on his way up to the NICU. I didn't know what a NICU was. I had never been in one. I did not know about neonatology, neonatologists, or all that staff that's up there. And for a family who is in what we perceived as a crisis situation, the staff really took us in and gave us step-by-step how everything was going to process through, all of the plans and all the procedures that he was going to bring him home healthy. And so we had that confidence and that comfort right from the beginning. So
like my husband said, we didn't really know what NICU was all about. We didn't know how long it was going to be. We didn't know about oxygen and all this other stuff that needed to happen. So they gave us like a day by day, what's going to happen, what's the overall plan, and that just made us feel, like my husband said, very confident that it was going to be okay. The nurses are our family. They are they were our eyes when we weren't here. They helped our son live. So I don't know how we can even explain what they mean to us. And since day one, we always felt like we can approach them about anything. We always felt that if we had questions, they would answer them. So many times we'd come in and they would talking to Michael and, changing his diaper or just saying things to him, and we're like, wow, it's like someone in the family was watching over him. So it always just felt like we can leave at night knowing that he was in good hands.